right, guys, we're gonna start new service line. Follow-ups for patients who had surgery somewhere else. We know people will travel and continue to travel no matter the warnings we give them, continue to travel either to different states or outside of the country for surgeries. A lot of doctors don't want to see them for follow-ups and don't want to deal with their complications because that's the risk. It's not that other surgeons don't know what they're doing in other states or other countries. Some of the surgeons are very qualified, highly trained surgeons. What if something happens? You either A, get stuck in that state or country in a hospital, or dealing with complications where you have to pay extra for the hotel, extra for airplane tickets, extra for whoever's helping you, or you got to find a surgeon here who will take care of you. And by taking care of, meaning anything varies from patients just freaking out at home. I don't know if I'm doing well. I need somebody to reassure me and make sure I'm doing well. Well visits after surgery to, I think I have seroma, which is the fluid collection somewhere in the body after the surgery that needs to be drained, evaluated and drained. People coming back with drains in place, the plastic tubes that stick out after tummy tucks and liposuctions, and they need to be removed, evaluated and removed. People with necrotic skin that needs to be debrided and cleaned and then have the wound care afterwards. All of those things can happen. Even had people coming in thinking they might have a blood clot in their leg. Well, we need to do ultrasound to evaluate for that. Now that's a little easier because with that you can go to ER. However, now going to ER is probably not the smartest thing because of the whole COVID. There are a lot of services that can be needed and a lot of things you have to consider when you travel to other country. Today I got a call, patient saying she's still in DR, but the surgeon over there saying, yeah, I could basically discharge you to go home, but you have to go with a drain. That means you have to give me the name of a surgeon who's going to be seeing you back home. Well, there's no surgeons in US that like to do that kind of stuff. It's very hard to find, mostly because, you're not their patient. They don't want to deal with your complication. 2, it's a liability for some of them, I guess they feel like. And 3, some of them just don't want to deal with patients who travel somewhere else. They prefer you stay here and do surgery. That's, I think, the honesty. Like, let's punish the dudes who went to other country. I don't feel like that way because, again, people are going to do what people are going to do. Couple things clear. When you're calling for consult for that kind of issue, it's not a free cosmetic consult because it's no longer cosmetic. You already had your cosmetic surgery. Now we're dealing with the complication. It's a standard surgical fees that apply. Now that it's been happening quite often, I'm going to put a website up on one of the pages on my website at surgicarearts.com where we're going to break down the prices. So that way you know what it may cost you if you have surgery somewhere else, if something happens and you need to come back to get evaluations, patient visit, ultrasound, drain removal, seroma drainage, which can happen recurrently. Sometimes we need to do it several times. Sometimes we do steroids injections. Sometimes we'll do revision on the scars. Sometimes touch up lipo, but then all of that adds up. So I need to make sure people are very clear on the potential cost of what ifs. Because yes, it looks like you're saving money traveling outside the country, but then if something happened, it's kind of like one of those things. You never know. There's plenty of people who go, nothing happens. They're very happy with their results. But the few that something does happen, they end up spending quite a lot of money for the post-op care. We're going to post it. It's going to be, as usual, transparent pricing. That's what we do here in Surgicare Arts and Ideal Body Institute. You guys decide. You can make your follow-up appointments before you go outside the country. That's fine. Set it up, put it in a schedule. I'm going to come see Dr. Angelina after I go to DR to get evaluated, get my ultrasound, get my drain out. Fine. We'll take care of you. If you have any questions or comments, let me know.